something else related to induction that I want to talk to you about in a short little clip is how we input data in relation to labour and delivery. A lot of us rely on the MSWs to input labour and delivery. However, sometimes they're not always available. The data entry that we put in relates a lot to data capture. This is proving difficult sometimes. So I want us to all be aware of what we put in and the information coming out at the other end. So I'm now in the patient's record. It's a patient we've used previously for induction, and I'm going to go into labour and delivery details. Ignore what's in this grid in the middle. We've done some striking out, we've done some induction, and we've done a bit of an ARM. So on the intrapartum list on the left-hand side, I'm going to pick labour and delivery details. So the type of onset of labour, now this is what's proving very difficult and causing a lot of confusion, data collection at the other end. Now, combination of surgical and medical induction. This relates to ladies that have had ProPES, prostin and an ARM. Surgical is your ARM, your medical is your ProPES and your prostin. So this is when they've had both. Your medical induction is just your ProPES or your prostin. No labour, this would relate to ladies that have not gone into labour, that have had an elective section, have had an emergency section, and have had no labour at all. Spontaneous, just a general spontaneous labourer. I hope that's self-explanatory. And a surgical induction, these are ladies that have not had any medical intervention, no ProPES, no prostin, and have had basically an ARM. So we'll select that, and then we'll complete the fields as required. I do feel from data capture a lot of fields get missed. These fields here, although they're not mandatory, they are very important. It highlights how long first and second stages are. So if we can fill in as many fields as possible, that will be very much appreciated. I'm going to click cancel, but ideally we want you to finish the rest of the form.